Now, unlike most other debts, medical debt's not a choice. People don't choose to have an accident or get cancer or suffer a heart attack. And medical debt not only impacts the uninsured, it also affects the underinsured as well. When you think about co-pays and co-insurance and deductibles and uncovered drugs and procedures, these can reach amounts that many people just simply cannot afford to pay. That large medical debt is a constant weight on many people, particularly when it goes to a judgment. Credit. They can keep people from getting loans and credit cards and even jobs into bankruptcy. And one thing we're seeing is that it also makes people avoid the preventive care that they need. I owe money. I'm not going to go in to get the care that I need. And also in talking with people who are suffering from medical debt, it's pretty clear that the mental toll, emotional toll of medical debt is significant. You know, most people want to pay their debts, and it is stressful on them when they can't. We've got out there organizations and churches and other groups like Undo Medical Debt. Jose and team, you're going to hear from them today. They're out there trying to help people, and it's amazing what a lot of them are doing. They're having success. But the need is so massive. It's more than these organizations can handle, and they'll be the first to tell you that. Approximately 2 million people in North Carolina owe about $4 billion in medical debt. Much of that is hospital debt. And that's what brings us here today and why we are so excited. North Carolina is launching a first of its kind in the nation effort to ease medical debt under which so many North Carolinians suffer. We've been given approval by the Center for Medicaid, Medicare, to use federal Health Care Access and Stabilization payments, HASP payments. Many people in the medical arena know about that. We've been able to use those to incentivize hospitals to do the right thing and forgive medical debt for low to middle income people and avoid the creation of medical debt on them in the future. So, by this Friday, if hospitals choose to participate in this medical debt forgiveness program, they will receive an enhanced HASP payment. They'll get a base payment if they don't choose to go this way. They'll get an additional payment if they choose to participate in this program. This makes sense for hospitals, their patients, and their communities. Statistics show that hospitals only collect about 5% of their medical debt. The old can't get blood out of a turnip analogy is here. But under this program, they will most likely, and their fiscal analysts are looking at this, you can bet your boots that they are, but they'll earn more than, by forgiving medical debt, than they would otherwise by not going in this direction. This enhanced money will be a financial benefit from them. They choose the higher amount and forgive the medical debt, or choose the lower amount and not participate in the program. We think they're going to be better off choosing getting the greater amount of money. We're excited about this. We believe that it can be a template for the rest rest of the country. We're eagerly anticipating what hospitals will do here. We've had positive conversations with them. I can't say enough about the innovation, creativity, and hard work of our Secretary of the Department of Health and Human Services, Cody Kinsley, and his team. They have been extraordinary in this effort. It is so complex, but it is one that's pretty simple when you get down to it at the end of the day. This is going to be an effort that will help our people and our economy thrive. So I'm now going to call on our Secretary of the Department of Health and Human Services, Cody Kinsley, to tell us a little bit more about this exciting project today. Secretary Kinsley.
Well, thank you so much, Governor Cooper and Chenavia, for having us here. It is wonderful to be at Caring always. I want to start by just underscoring that Governor Cooper's leadership on healthcare in North Carolina has been truly transformational. And it's been transformational because it started with a basic premise that having access to health and what makes you healthy is a basic human right, and that we have to use every lever we have to go after making it easier for people to be healthy. Starting with the first in the nation pilot to invest in what drives health, food, transportation, and other social determinants of health. Recognizing that without access to health insurance, you can't participate in the healthcare system. And after a 10-year battle, when many people believed it couldn't be done, getting Medicaid expanded. Getting nearly $1 billion of an investment for mental health. We know that is something so foundational to overall health. And now the logical next step, which is recognizing that in every state and for every hospital that we have looked at that holds immense amounts of medical debt that is almost never collected, truly what it is just a stumbling block for people to be healthy and tackling that. Medical debt is in of itself a disease in our health system. As Governor Cooper said, no one chooses to go into medical debt. No one chooses to have cancer. They don't choose to have a heart attack. They don't choose to get in a car accident. And when they show up at the emergency room, they don't say, hold on a minute, what's the price? Second, hospitals spend considerable time and energy chasing this debt with calls and letters and staff trying to get debt that, as Governor Cooper said, is never collected. Pennies on the dollar. And yet, with all of that activity yielding very little value, 67% of bankruptcies in this country are attributed to medical debt. And third, even if it's not collected, the weight, the emotional and financial burden of this debt rests heavy on the people of North Carolina. They get to the end of the day, they look at the stack of bills, and they try to decide, are they going to pay rent? Are they going to buy food? Are they going to pay for Dad's stroke last year? Even if the debt is small, $100, they think, if I walk into the primary care doctor for my annual checkup, the first thing that that person is going to ask me about is what I owe them from my last visit. And I don't have $100 plus $30 copay. How can this work? This debt is sitting on the burden of folks, and it is keeping people stuck in a cycle where they end up in the emergency department sicker and more costly. It makes no sense for the people of North Carolina. This policy is the potential to treat this disease in our health system. It breaks this cycle of sickness where people face high costs and stuck in EDs by wiping away debt back to January 1st, 2014 for people up to 350% of the federal poverty limit. And looking forward, it allows hospitals to focus on their mission and what we know they care so deeply about, caring for their communities, by putting in place higher standards for charity care policies and better practices for debt collection for those parts of debt that do need to be collected, and a responsibility to get people enrolled in the charity care programs that they already have. But for this medicine to take hold, hospitals have a choice. And we need them to say yes, and to say yes by Friday. And we know that if they do, as Governor Cooper said, we're looking at nearly $4 billion of relief for 2 million North Carolinians. And taken, in part of all of this, a healthier future for all of North Carolina. There is a particular organization that has been at our side throughout this entire process. National leaders who have worked to tackle this challenge, who have also thought deeply about how to implement it in a way that works well for hospitals and well for the people that we serve. I'm so grateful that they're represented here today, Undo Medical Debt, and our deep partner there, Jose.
Good afternoon, everyone. My name is Jose Penabad, and I am a board member at Undo Medical Debt, and I'm also a fellow North Carolinian living here in Raleigh. Our organization is now celebrating its 10th anniversary, and we have worked to relieve over $13 billion in medical debt for over 8.6 million people in the United States, and we have touched every single state of the union. To date, we have worked with over 240 different provider groups, hospitals, and physician groups across the country in these efforts. And on top of that, since 2022, we have launched 17 state and local government collaborations, including with Cook County, Toledo, Arizona, and New Jersey, that we anticipate that over the next several years will go on to provide an additional $7 billion of medical debt for those communities. Soon, we are looking forward to working with our friends here in North Carolina to continue that mission as we also try to knock down $4 billion of debt in our great state. Our long-term goal is to work in partnership, in collaboration with the healthcare system, with patients, and with the government to really attack the root causes upstream that are causing medical debt that impact many of our friends, family, and neighbors. But as we look around today, what we see is a situation where many of our fellow Americans, and indeed our country, finds itself in a hole being dug by medical debt. And growing up, my parents taught me that the first rule about getting out of a hole is to stop digging. So that's what we're here to try to do today, is stop digging the hole. And with that, we'll talk a little bit about how Undo has worked with other hospitals and provider groups across the nation and why we think North Carolina's approach could really be successful. In the past, we've approached hospital groups and we have purchased medical debt from hospital groups and providers across the country, as I mentioned, typically for pennies on the dollar. And we are creating what we believe is a win-win situation, not just for the patient, but for the hospitals themselves. For the patients, as Governor Cooper and Secretary Kinsley just talked about, there's a lot of relief. There's relief from the debt collection calls, the letters, the debts that are existing. Also the mental toil of having this debt, the avoidance of care that's preventative, and so that the next time that these people appear in our hospital system, still unable to pay for these medical bills, they show up much sicker, and it's much more expensive. It's not helping anyone. And relieving this debt allows them the freedom to once again engage in our healthcare system. That is a huge relief, and that's a win. But some of you may ask, how is this a win for hospitals when they're getting pennies on the dollar? I think Governor Cooper covered it well. Most of these debts are uncollectible, and from a purely financial standpoint, our organization is buying debt that is truly economically worth nothing. It is uncollectible statistically, and it's been written off in most cases as an accounting write-off by the time we see it. So we're giving money to hospitals essentially for something that's worthless, and in turn, turning it around and forgiving debt for the people who owe it. So we think it's great. We think for hospitals, giving money to the people who are serving our communities, who are integral in providing the care that our communities need, is great. And if this is a way that we can create a win-win, we think it's wonderful. And in our experience, what we found is many people feel that way as well. So as we look forward, we wonder the story of medical debt. And for some of you that don't know it, medical debt is an enormous problem in this country. I'm going to quote the Kaiser Family Foundation and their study from February of 24 to talk about some of these numbers. But they estimate that 1 in 12 Americans have medical debt on their record as we speak today. They estimate that that number impacts 20 million Americans. 20 million. we're talking about 3 million Americans who owe $10,000 or more in medical debt today. And they estimate the total cost of medical debt is at least $220 billion, and that does not account for anything on credit card debts or any loans or other mortgages taken to cover these debts. It's at least that big. And if I were to cite the number I just gave you, we've already forgiven $13 billion of debt, and I just told you we're trying to forgive another somewhere between 7 and 11. So we are only getting to the very surface of this problem. This medical debt, how does it form? Well, we don't have a good cause. That's why we're here trying to learn how to fix it, and we're trying to make changes to fix it. And as we think about it, here's a couple stats to consider. The average American, over 50% of them, do not have $500 in their savings account for an emergency. Yet, the average deductible in the United States is $1,900. So very quickly, you can see how a medical emergency that hits into your deductible could become a financial emergency that you can't handle if it really gets out of hand. And that is not an elective issue. As Governor said, these are people who are not trying to be in the hospital and take on this debt. As the Secretary noted as well, it's not like they're going out there shopping. A study by the CFPB points that 4 out of 10 Americans are more scared of medical debt than of serious illness, which speaks to the people's feeling of fear and shame when they have medical debt to not see their providers and seek care. So, as I stand here as an undue board member, I have to say that we are incredibly excited at the approach that North Carolina has taken on this and the leadership they have shown in this approach. What we mean by that is it is a combination of short-term activity and long-term planning from a policy perspective that we really think can not only make a dent today, but a long-term dent in the issue of medical debt that plagues not only our state, but really our entire country. So thank you to everyone who's worked on this. Thank you to the Governor and the Secretary. Thank you to everyone who supported this. And we at our organization stand by ready to assist North Carolina in its effort to undo medical debt. Thank you.
So now the Secretary and Jose and I will take questions from the media. So
We can start right here on the end. Or we can start on the other end. Go ahead.
Yeah, Ames Alexander with the Charlotte Observer. How many hospitals have signed commitment letters to participate in this program so far? You know?
they're starting to come in. I'm going to let Cody give you the number right at the moment. It's like election results.
I'll start by saying that every hospital we've heard from officially so far has said yes. And that count is 37 of 99 hospitals. And they are Western Carolina Hospital, Hugh Chatham Hospital, and all of the hospitals in the systems of Cone Health, UNC, ECU, and Novant.
Next question. Right there. Go ahead.
Hey, how you doing? Kevin Nelson, Business, North Carolina.
Yes, sir.
How much money are we talking about in incentives paying out? You said $4 billion a day, but how much does that cost taxpayers?
So the HAS payments are coming anyway, and I'm going to let Secretary Kinsley talk about that amount of money. But this is money that is to help hospitals with stabilization. It has been essentially unrestricted before, but we decided that we should get more effective and efficient use of this money for the taxpayers, and believe that this was a good requirement to put on hospitals to be able to get more of this money. We've given them a baseline amount, but in order to get the top amount, they need to do this. And I'm going to let Cody talk with you about the amount.
So the HASP program, as Governor Cooper said, is a federal program that many states take use of. And it's a directed payment program that provides money to hospitals to stabilize their services so that they can be available and ready for all beneficiaries, including Medicaid beneficiaries. North Carolina last year drew down roughly $2.9 billion in directed payments for hospitals as part of that program. So as Governor Cooper said, hospitals can continue to get that drawdown at that level and not sign up as part of the program. If they choose to join the program, then we've been able to negotiate with the federal government, and based off our increased population on Medicaid and a number of other drivers, the total amount that we can draw down in this next year will be $4 billion. So it's a considerable increase over the prior year. Because again, the number of people on Medicaid and a number of other drivers, in the following year, it will be over $6 billion. These are estimates, they tweak just a little bit as they grow, so, and they change. So the point is that, as Governor Cooper said, these are dollars that are flowing into North Carolina to stabilize the system and to improve the health care of North Carolina. Our strategy is to tie policies into them and incentives that get better bang for our buck to make sure that these dollars are going to good use. There's no additional new dollars or new taxes and no cost to the state taxpayer.
How much of incentive, so how much could these hospitals receive if they participate versus if they don't?
So the total amount that the baseline, if no hospital participates, would be $2.9 billion. And if all say yes, it'll be $4 billion. Each individual hospital, it's a different amount, depending on the number of Medicaid patients they see and a number of other things. Happy to follow up afterwards, and we can give you the specific amounts for each hospital.
Next question right here.
Michelle Crouch, North Carolina Health News. So what is your response to the concerns of rural hospitals who stand to get smaller payment and who have concerns about the cost of implementing this? Are you going to offer them any additional support?
Well, first I'll say it's telling that the very first hospital that said yes to us last week was a small rural hospital in far western North Carolina. And now we have seen in the hospitals that I just outlined a beautiful representation of hospitals of every size and every geography, that the dollars clearly make sense for them, that a stable funding source put to good use in relieving debt that, as Jose beautifully outlined, is rarely ever collected, is the right choice. But we've been working with our hospital partners from the beginning to shape this in a way that could be implemented easily and make sense. We've provided technical assistance already in our conversations with them. They've given us feedback on how to adjust the policy to improve it so that it could be more easily implemented, and we'll continue to work with them to put whatever needs to be done in place to make this easy for North Carolina.
Any questions from the back? Great, last question right here.
Someone said that hospitals should be making more charity care already, and that these incentives are not needed. Hospitals just need to step up and provide more of that money. How do you respond to that, Governor Cooper?
Hospitals do have charity care programs in place. The problem we're seeing is that people don't know about them. They don't take advantage of them. The beauty of this program is that if they take this additional money, then it's the hospital's responsibility to make sure that these patients are enrolled in these charity care programs so that they would get the help. So these things already exist, and this is going to push to make sure that folks get enrolled. You may want to amplify that.
But why aren't hospitals already making sure people get enrolled? Why aren't hospitals doing this? Why do you have to bribe them, give them more money?
I'm going to let you ask them that question.
But no, that's a question for you. Why are you having to give them more money to do something that you're saying they should already be doing?
So the federal requirements for public benefits that hospitals have to provide are set by the IRS and their Internal Revenue Service regulations. And I want to, again, applaud our hospital partners who do considerable investments in their communities that look like charity care programs, that look like mobile buses, investments in places like this, and a number of other things. What we're doing in this policy is prioritizing their charity care programs to tackle medical debt. And again, these are dollars through state-directed payments programs that are flowing into North Carolina already, and it's continuing to align our incentives and all of our regulatory tools to point in the direction of getting the value for North Carolina.
That's the time we've got. Thanks, y'all.
Thanks, guys.